Thank you, Usul. Very good afternoon, everyone. Very glad to be able to welcome you here, especially those of you who are not from Singapore, not from NTU, and from STEM backgrounds. Welcome. Actually, I was just told 3 minutes before we started that I'm supposed to give opening remarks. So a bit stressed because I didn't plan. But in a sense, I don't need to plan. I mean, our speaker, Pak Anis, I don't think needs any introduction. He's well known, I think, to a lot of you. Of course, Sul later will introduce him formally. But I just want to take this opportunity, Pak, to welcome you on behalf of the leadership of NTU and also on behalf of my colleagues in the College of Humanities, Arts and Social Science. I think Pak Anis Baswedan has a long and illustrious record as an administrator, as a leader, but importantly, as an intellectual and academic as well, which was his initial calling before he had other callings. But what that means is what he brings to issues like urban leadership and digital resilience, intellectual frameworks and concepts that I think those of us in universities, working in a university environment, appreciate very much, because it suggests that the things that we teach and research in an academic world is not confined to the academic world and really has real life applications. And no better example than distinguished academics who go on to become distinguished leaders and administrators in real life, so to speak. So on that note, again, Pak, thank you very much for coming down to Singapore. He's only got a few hours here, and so all the more grateful that you are spending it with us. Thank you, Pak.
Okay, thank you so much, Prof. Leo, for the opening remarks. Actually, Pak Baswedan has a very long list of CV, and I've tried to memorize everything here. So before I invite Pak Baswedan to give the lecture, let me just give you a short intro of his background. So Dr. Anis Baswedan is a notable academic and public intellectual from Indonesia. He completed a PhD in political science at Northern Illinois University in the United States. And when he returned to Indonesia in 2007, he was appointed as the president of Paramadina University. And back then, he was the youngest president of university in the country. And then during his tenure at Paramadina University, he initiated an educational movement called Indonesia Mengajar, which is a fascinating program that sends fresh university graduates to remote areas across Indonesia archipelago to teach students physics, chemistry, science, language, social studies, and etc. And it has a huge impact not only to those in the remote areas, but also those who goes to those places to teach, so they have an experience and realizing the social realities of Indonesian society. In 2014, Pak Anis was appointed as the Minister of Education and Culture by President Joko Widodo. And in 2017, he ran for governor and won the election at the governor election in Jakarta. So he became governor of Jakarta from 2017 to 2022. And during his tenureship in Jakarta as a governor, he received numerous awards. But one most notable that I remember is that he was awarded as one of the 21 heroes by Transformative Urban Mobility Initiative of TUMI. And this is due to his success in transforming the public transportation system in Jakarta. Now, today's talk is going to be about something different from urban mobility. And I think this is a talk that he hasn't given before. So I'm really excited to hear about that, because it's something related to what I'm teaching here actually, which is disaster resilience. So without further ado, please join me in welcoming Dr. Anis Rashid Baswedan.
Thank you, Professor Sufikar, Professor Leo, and all distinguished professors and all participants. It is indeed an honor, privilege to be back to NTU and share some of our experience from the neighboring city of Jakarta. Visit Jakarta is not that far from Singapore, and what I will be sharing today about urban leadership has a lot to do with the crisis that we went through since 2020, which is the COVID pandemic. And it hits countries across the globe, cities, and I think now is time for many of us to start picking up lesson learned. In Bahasa Indonesia, there is a word called hikmah. Hikmah is lessons that you pick up after a period or after something is happening. Then it is called hikmah. And the hikmah is always coming after the crisis, after the event. No hikmah is coming before the event, before the crisis. So now it's time for us to start learning, picking up some of those lessons and prepared us better for future challenges. We hope we don't have to face similar challenge, but if we do, what are key lessons learned that we can pick up from the crisis that we had? So allow me to share some of the basics about Jakarta. Okay, yeah. Just a minute, let me make sure. All right. Give you basic data. Jakarta is a city of 11 million people within the city, plus its surrounding, its neighboring cities, another 23 millions. So plus minus, it's about 35 million people in that area. And the city contributed about 17% of Indonesian economy. So on the one hand, we are congested in terms of populations. The number is 11 millions compared to the entire Indonesia, which is 270 millions. So the proportion is small, but on the other hand, our contribution to the economy is huge. And Jakarta is the gateway of Indonesia. If you enter Indonesia, then the gateway is Jakarta, and if you're departing to the world, it's always through Jakarta. So when we started to see a contagious virus in Wuhan, at that time it was December 2019, we were monitoring in Jakarta, and at that time it was still called pneumonia Wuhan. It wasn't called COVID, and I think SARS-CoV-2 virus was there, but rarely mentioned. It was basically pneumonia Wuhan, and we are monitoring closely. Why the Jakarta government monitoring closely? Because our city is having direct connection with Wuhan. There's many direct flights coming in, and then our city is the hub of Indonesia. If we are having problems, then the rest of Indonesia will at some point also experiencing what we are experiencing. So it was our concern. And I remember in the beginning of January 2020, we had meetings with inter-departments representative. And those meetings, the immigrations was invited, the intelligence office was invited, all agencies that relates to mobility, that relates to international travels were all invited. It is a rare occasion because Jakarta government rarely inviting all those agencies that deal with international travelers. Usually we're dealing with domestic travelers, but this time was international travelers. The question was this: how many people coming back from international places where the virus have been detected then? And our data was so minimum. We had minimum database on tracking people, and I think at that time we're not tracking people yet. We're not identifying where have you been visiting of cities, of countries at that time. So very minimum information. So immediately we start our second approach. Let's identify to anyone who have symptoms similar to pneumonia Wuhan. So we send like a booklet, like a instruction book to all hospitals in Jakarta. If you are seeing patients with these symptoms, do report to us. What basically we're doing is this: let's anticipate what is coming from outside, and then two, let's anticipate what is happening within our jurisdiction. We have about 190 hospitals across Jakarta. So all hospitals were having these instructions and they have to monitor. So we have been receiving reports of individuals with similar symptoms of COVID. At that time, we're talking about early 2020, the authority to undertake the testing was not in the provincial government. It is at the national government, Ministry of Health. We have PCR machine to do testing for viruses, but we didn't have the reagent for extracting and doing the testing. Only labs that is authorized for certain virus, they will get the reagent for that particular virus. So SARS-CoV-2 was not on our list, so we didn't have the reagent, even though we have the PCR machine. So what happened was, we keep sending samples collected from hospitals to our Department of Health, sending it to central government, to the Ministry of Health, the laboratory. However, we keep getting answer that the answer is no answer, basically. At that time, we didn't get, is it a positive? Is it a negative? Basically, we didn't get an answer. We keep sending samples and we don't get answers back. Now, our team is reporting to the governor. As governor, we have been reporting this many. We have not heard anything back. What should we do? So we communicated with the Ministry of Health, demanding result, being informed to us. We didn't get any reply. This is talking about how should we deal when we are facing this kind of situations. What should we do? Should we just wait, or should we do something? I decided to go to the public and report to the public that Jakarta, it was 1st of March 2020. I went out to the public and said, we have had X patients under surveillance, under monitoring, and these are numbers of individuals detected with symptom of COVID. And it was a news that the country has been avoiding for weeks. Nobody wants to talk there is COVID in Indonesia at that time. And it was, I announced it in the morning, late afternoon, the Minister of Health were saying the number reported by Governor of Jakarta was incorrect. Okay? So basically, they were saying there is no cases. And we come up with that. But what are the key aspect here? Why there is that difference? The Ministry of Health, who has not been out front in explaining what is happening, and our approach that has been, let's open up, let's inform public. Here's the difference, or here is our lesson learned. During the period of January, February, we have been reading what is happening outside the country. Our team were monitoring news outside Indonesia, reading policymakers outside Indonesia, talking about COVID. If your team don't speak English, then you know nothing about what is happening outside the country. If you don't read things outside, you have to really understand what is happening in the world. So in March, not long after that event, I gathered about 150 leaders of our city. These are head of departments, head of agency, head of bureau, head of hospital, directors, all, about 150 people. Gathering just like this gathering, 150 people. And I started the gathering by asking simple questions. Raise your hand if you read news about Jakarta every day. So all these 150 people were raising their hand, all of them. Because they work for Jakarta, they better read news about Jakarta every day. Everyone is raising their hand. Second questions. How many of you read news about Indonesia every day, national news? Almost all, not all, almost all. Third questions. How many of you were reading world news, global news every day? Only 7. Okay? So I mentioned to all of you. So for all of you, from now on, listen to what I'm going to say and trust me. Okay? Because you have not been following news outside Indonesia. If you don't follow news outside Indonesia, then you don't know that there is, a disaster is coming. And we better be prepared. Rule number 1, I mentioned that in that room. Do not handshake from now on. And everyone's like, do not handshake? What do you mean? No handshakes? Yes, from today, no more handshake. Social distancing. And everyone's like, really, social distancing? We used to be very intimate, right? We meet each other, we kiss, we hug, we handshake, and then suddenly stop all of that. So all these measures that not us invented those measures. We are learning from others that have faced these problems earlier than us. It was March. Wuhan experienced it since November, December, and then Korea experienced it in January, and then Iran is around that time, Italy is around that time. We are picking up lesson learned from them. And we share that to our team. And then number 2, what was also a lesson learned is this. We realized early on that this kind of, quote, disaster is going to take place in a long period of time, which we don't know how long. It could be a year, it could be 2 years, it could be 3 years, we didn't know at that time. But it's not going to be over in the next few months. And then we look at data of the last pandemic, the flu pandemic in the early 20th century. And you look at the data, it takes so many years for that pandemic to end. So we're expecting, and we start looking at numbers of casualties in Jakarta, in Indonesia, during the flu pandemic. And the numbers of death was quite significant then, in the 100 years ago. With long-term disasters like this, what is needed from government to the general public, in our perspective, is one word: trust. We need the public to trust us. If they don't trust us, there is no way we can collaborate. There is no way that the public is going to listen to what government is advising the general public to do. because it requires everyone to get engaged. To break the circuit, it requires everyone in our populations to be actively involved. So the key here is trust. If we build trust, we will be able to go through the crisis, and we'll be able to sort of allow our policy to be implemented by everyone, not only by a certain group of individuals, but by everyone. And that has been our approach. Why we had that in mind? I had the opportunity, to engage with city mayors across the globe. I was active in the C40. C40 is an association of mayors of big cities. I serve as the vice chairman of C40 steering committee. The chairman was the mayor of LA at that time. The vice chairman is the mayor of the governor of Tokyo and governor of Jakarta. So we organize many meetings with all these mayors. Who are the speakers of all these meetings? Mayors in cities that experience the pandemic early stage. So Mayor Park of Seoul, and then mayors of Milan, and then mayors of some countries in Northern Europe, Tehran, and many other cities that have experienced earlier than us. All mayors across the globe were participating on those meetings, and they were listening testimony of our fellow mayors sharing their tough times in a very emotional way. When they were sharing, "Sir, our hospital is unable to take care of all these patients. They are, on the hallway. They're in the hallway. They have, pictures that we have started to see in the months later. But at that time, we've been listening to all these mayors. And then they've been saying, please do this necessary measure. Preparing a quarantine area, enlarging your capacity. So many of these lessons learned from other places were being noted down, and we started to adopt that. But one thing that we thought was clear, trust is key. And to gain trust, at least there are three components of trust. One, and it's like a function. It's like a model. Trust equal, one, competence, plus integrity, plus intimacy. Then you get trust. You want to be trusted, you have to have competence. You want to be trusted, you have to have integrity. You want to be trusted, you have to have intimacy with whoever is going to trust you. So those three variables. But number one is on the competence. Then you need to understand the problem. We invited scholars, scientists to actually come and tell us what needs to be done. I remember a meeting in March 14. 3 days after WHO declared pandemic. Pandemic was declared on March 11. So March 14, it was Saturday evening, Saturday afternoon, we had a meetings and we invited everyone meaning all important stakeholders, the Association of Epidemiologists, Association of Hospital Leaders, head of faculties of medicine, and WHO. And this is also a turning moment for me, a turning point at that time. Why? The WHO representative in Jakarta confirmed he was going to join. When the meeting started, he wasn't there. Okay? So we called him and said, we have invited you to join. And they said, yes, I'm joining it online. Okay? We're talking about March 2020, not March 2021. Having a meeting online was still very rare, okay? And he said, our procedure at WHO is we are no longer allowed to attend face-to-face meetings. We are only allowed to do an online meeting, teleconference. And it was an eye-opening for me, oh my God. And we all here in the room, face-to-face, no mask, no face covering, and we were in the stage of ignorance at that time. Okay? And then this is an eye-opening statement from the head of WHO representative in Jakarta, saying that I'll contribute. And during that meeting, we decided to close all schools in Jakarta, starting on Monday, 16th of March, and then close all parks, close all public facilities. The move was not popular at all. Why? Because the general public is not seeing victims yet. Okay? And we know the numbers is growing from our hospitals reports. But we are not seeing the result coming back from our testing yet. So we had to adopt a policy that may not be in favor of the general public. And number two, the national government also not in favor of that policy. And you have to adopt it in the capital city. And that was sort of the constraints or the dilemma that we face. But we keep telling ourselves, we better do the right thing. Because this is what all the scientists on epidemiology has been advising. This is the way to go. So on the competent aspects, learn from the expert. We were no expert on epidemiology at that time. So lesson number two is integrity. Tell the truth. No sugarcoating. Do not hide any numbers. Just tell the truth. And the truth may not be fun. It can be painful, but you just have to tell the truth. Without telling the truth, then we will go nowhere. So, with that, give you one example of telling the truth. Look, this is funeral services in Jakarta since January 2018 all the way to February 2020. So this is monthly funeral services. Jakarta is perhaps the only provincial government that manages cemetery, that manages funeral services. No other provinces is dealing with this, but only us. There's limited space of land. So we manage cemetery, we manage funeral services. The average funeral services is around 2,700. That's average for 2 years prior to that. And then in March, suddenly it increased to 4,400. In April, that's the same thing. Something must have gone very wrong, right? On the other hand, the health department was not able to know what have been the result of our testing. We have been testing, and the test never come back to us with positive result. And you report to the Ministry of Health, and the Ministry of Health is coming back with no answers. So that was the kind of dilemma. And when we presented this, there was a general reactions. Pak Gubernur, please do not exaggerate the problem. Okay? Do not exaggerate. And what we are saying is this is fact. I'm not exaggerating. This is fact. That we have been providing service at the average of 700. Why it suddenly become 4,400? In spike. And then we look at hospital bills. Hospital bills was so interesting. Why in our insurance system? Because bills for pneumonia doubled and tripled. But it was categorized as pneumonia. Something has gone very wrong. As leaders in that city, I have to decide, should I keep this data myself and my team? Should I go public? Should I tell the general public? I decided to do the latter. I go out to the public and said, this is a fact and we better be prepared. Something big is coming up to our city. We are not realizing it yet, but we have to start a restrictive measure immediately. And so that was a period in which you have to hold on the values that you believe in. And it was a time where many were writing public opinion of the general public who were not yet informed of the magnitude of the consequences of this pandemic. The experts has been saying this is quite dangerous. We better do something. So we went out and do transparency measures. All data is being presented there. However, this is not enough. What we're doing is we build, let me put it this. From the beginning, we said that symmetric informations on COVID pandemic for the people of Jakarta, and that we are all in this together. So I want to make sure that everyone in our city, they know exactly what we know. We want everyone to know what is happening. And we created a new platform called corona.jakarta.go.id. And we established this from the very beginning, that everyone can access this data, and you can look at the map. Ada laser, you have laser pointers here. You have a map here. So for our residents, they're able to click maps, and they're able to click the district they live, the neighborhood they live, and then it will then emerge number of cases in that area. So we started building an information system that allow our citizens to know how many cases in their neighborhood, and even to the RT level. RT is the neighborhood level. And when we built this, we're able to know mortality rates, and when it comes to mortality rate, they can also check in their own district how many cases of mortality in every district. The idea is to ensure everyone that we are on board together. This is what we know, this is the measures we're taking, and this is what you need to do. And with that in mind, we are grateful to know, to report today that when we adopt a more restrictive policy, the public generally obey to our policy. For example, when we have to close down a house of worship, that wasn't easy, but we gather leaders of all religious groups, explain to them the situations, explain the consequences, and they all said, okay, sir, we listen to you, you decide, we follow. And we went out to public with a press conference, me explaining steps will be taken, and all religious leaders take turn endorsing the decision, and general publics listening to that. Why that is the case? Again, we need to build trust. And intimacy, what I mentioned the last point, is key. You need to communicate closely to all these groups in our society, be it religious group, be it ethnic groups, be it community leaders build that intimacy through intensive communications, then you gain trust. So competency, and then integrity, and then intimacy. That's key. And with this transparency, it truly helped our approach. The rest is more technical. Increase our capacity to do testing. And our approach has been collaboration. Collaborations meaning, so this is the approach I mentioned. My presentation is not following the PowerPoint, but following the structure of our experience. Okay? The collaborations is key because let me share to you. When we started this journey, beginning of 2020, our testing capacity in the government of Jakarta is only 150 cases per day. Because the PCR test was never used as a diagnostic tools for diseases. And suddenly you have this COVID-19 that requires PCR testing as a diagnostic measures. So we have to multiply our capacity. Now, the approach was this: one, we enlarge our capacity on our own, or two, we call all laboratory across the city. How many of you have PCR machines? How many of you have extraction machine? Let's collaborate. We will send you the samples, and then we will refund all expenses. Instead of us investing on new equipments. That has been our approach. And with that approach, Jakarta was able to do testing way much higher than the WHO would require us. So our capacity is much higher. We're actually better than New York. We're actually better than many major cities across the globe. Not because us expanding our capacity, but because we did it in a collaborative way. And we have so many labs that we didn't know they had PCR machines. And then they all signing up. All expenses is covered by city government. That's at the early stage in terms of testing capacity, which is needed. Number two is all hospitals were being invited to join. And at the beginning, many hospitals were rather hesitant on handling COVID patients for obvious reason. Because then you have to basically segregate the hospital for COVID patients and non-COVID patients. The procedure is completely different. And this is also one of another eye-opening session for me. One was the WHO that said, no more no more face-to-face meeting. But the second was this. I came to a COVID hospital. It was mid of March to visit someone who has been treated for COVID. When I arrived into that hospital, at the gate of the hospital, there is a chain in the gate. So the gate was basically locked. So I asked the security there and with our team, I'd like to make a visit. And they said, sir, the hospital is closed for visitors. You cannot even come in and park. It was basically blocked. Why? Because this is a COVID hospital. Today we know what is COVID hospital. But then, it was an eye-opening. Oh my God. So it's completely isolated. You're not entering the facility. So all hospitals many or private hospitals were invited to join the networks. And again, in the collaborations. The way we did it is like this. You take care of the patients, we will take care of the bills. But you do your part. Don't worry about bills. We will take care of the bills later. We'll take care. And with that, our capacity has enlarged. So Jakarta's hospital facility for COVID in terms of percentage was the highest. And even our neighboring residents, whenever they had a positive case, they would rather be treated in Jakarta rather than in their local hospitals, because the hospitals in Jakarta has been treating since the beginning of 2020. So they knew, they have been exposed to all of this. And again, collaboration is key. Without collaboration, there is no way we're able to do what we did. So the third point that I mentioned, really science-driven. During a crisis like this, policymakers, politicians, city leaders, they all were facing situation that is unknown before. You are entering a situations where you have no previous experience. Unlike other crises, unlike other disasters, where it happens once and then we started to do recovery. Give you examples. You have earthquake, you have tsunami, you have flood. It happens on a particular day, and then the days after that you start doing recovery. But this time, it happens today, it happens tomorrow, it happens next week, it happens next month. And we are talking about human here. We're not simply talking about statistics. One of our difficult times is whenever myself is 6 p.m. every day. That was one of the most painful hours every day. Why 6 p.m. is painful? Because at 6 p.m. I will be receiving updates from our Department of Cemetery informing how many funeral services is being done on that particular day. The cutoff is 6 p.m. for the past 24 hours. And you waited at 5:30, you wanted to see a decline from yesterday. And then when you see an increase, my God, it is going up. And then another going up. And emotionally, it was very taxing, because you are not talking about statistics. These are individuals with families. And we met many of them. So the approach that we had to adopt is an approach that relies on scientific approach, relied on data. Something that we have been doing in the past, we didn't realize it explicitly, but during a crisis like this, you really have to rely on that. Rely on science, rely on the scientists to give us guidance. And it is easy to distinguish policymakers, those who trust on instincts and those who trust on data and trust on science. That was the period. So of all challenges, this is the time, the pandemic was the time for us to actually reflect that we have to train ourselves to start listening more to the scientists on many issues, not only on the issue of pandemic, but the pandemic is an eye-opening event that forces us to adopt that. So that has been our approach. And all along, the others are small technicalities. You started enlarging the testing capacity, you start enlarging tracing capacity. All of that is just technicalities. But the key is, one, willingness to learn and to unlearn, willingness to put priority on saving lives, and the approach is that let's make sure that the general public trusts government. Without trust, we're not going to go anywhere in terms of moving the entire society. The challenge is of course numerous. It's more technicalities. So I'll end my initial remark here. I'm happy to entertain comments and questions, and you're welcome to ask any questions regarding this subject. Thank you.